But doctor, there are quite a few other ways to preserve fertility treatments without having to freeze. So you walk us through them. We have a graphic showing some of these.
Yeah. So obviously she chose the second option that we see on the screen. First option is similar in the sense that we preserve the embryo. So this is when you already know the sperm donor who's going to be, whether it's your husband, boyfriend, and you're 100% sure you want to preserve a fecunded egg already, a fertilized egg, then you choose to do embryo preservation. You can do a combination. You can preserve eggs, which is, without a sperm fertilization, or you can preserve embryos. And then you can do, in case that we use radiation to the pelvis, as I mentioned before, for example, in gynecological cancers, you can do gonadal shielding, or you can do something called ovarian transposition, where we actually surgically move the ovaries away from the treatment field.
Okay.
Again, thinking about local radiation is a focal radiation.
So the ovary is not affected.
Exactly. So we remove it on the field, and then in case, like, for example, in cervical cancer, the fifth option right there, which is removal of the cervix without necessarily having to remove the whole uterus. So that will allow us to potentially implant an embryo in a uterus without having a cervix that needed to be removed surgically. That's called trachelectomy, let's say for the treatment of cervical cancer, without the need to remove the whole uterus and pretty much cease the option of fertility for that person. So, and then you do C-section and you can go through a viable pregnancy after that. So.